You're listening to the Active Mom Podcast with host Dr. Carrie Pagliano. I'm a mom, physical therapist, and your go-to guide for staying active with pelvic health issues in pregnancy, postpartum, perimenopause, and beyond. Whether you're a fellow mom, physical therapist, or women's health professional, join me where I'll share expert insights, real-life stories, and the latest research to help you approach running, CrossFit, yoga, Pilates, HIIT, or whatever activity you love with confidence and evidence-informed guidance. Let's start the show. All right, welcome to the Active Mom Podcast. We got a little solo episode for you today. I wanted to chat a little bit about just a lot of the information that's out there as far as getting back to running postpartum, and even in pregnancy for that matter. I'm on a lot of different Facebook groups geared towards running, and it's really great to see, number one, how many moms are staying active or trying to stay active in pregnancy, and how many moms want to get back to running, quite honestly, in postpartum and have goals and things that they want to accomplish. And I love the community that has been created by moms who want to stay active and keep their identity as a runner or kind of build that mother runner identity. It's really cool to see because, quite honestly, it's a relatively new thing. I don't think that kind of community was necessarily around 10 or 15 years ago, because, even though there's still people that poo-poo and have to make comments about pregnant women running and, moms running in postpartum, it really wasn't, it was kind of frowned upon for a really long time. And I feel like it's a lot more socially acceptable now. We have a lot more examples in our pro athletes and just in social media and just people seeing it more, and it's just more socially acceptable. That said, I do see a lot of people that are crowdsourcing information on these groups and, basically asking others, what was your experience? How do I know when it's time? What should I be doing to get back to running? And it's always curious as a professional that this is my day job. I did a significant amount of training to kind of learn how to do this, lots of years of experience. It's always interesting when people crowdsource. But it's helpful for me because I get to get that insight into what people are looking for. What questions do they have? Where are we not clear as advocates and educators to help women find pathways? And I thought it would be fun if I asked our dear friend ChatGPT what are the questions that women ask about. And some of them, honestly, they were very similar to what comes up in a lot of these Facebook groups, and what the advice was. And to be honest, there's not a lot of difference because, again, ChatGPT pulls from what's out there on the internet to answer the questions. But I thought that could kind of guide the discussion a little bit today because, again, it's great because this is generally what I hear, but I also want to kind of chat a little bit about, this is great general advice. If that advice doesn't apply to you, then what do you do? And that very much is my area of expertise, is hey, when you've done all the things you think you're supposed to be doing and it's still not working, then what? And that's where problem solving and critical thinking and looking for patterns and experience can be incredibly helpful here. So I said, hey, ChatGPT, what's the top 3 questions? And the top 3 questions really weren't surprising. When is it safe to start running? What are the signs that indicate that I'm ready to run? And what steps can I take to safely return to running? And again, I think the average mom, those are going to be the things that they want to know, and maybe even have an idea in pregnancy of potentially what that might look like in postpartum. So what's really, really interesting, and I credit the 2019 UK guidelines from Grania Donnelly, Emma Brockwell, Tom Goom. I credit them for kind of spawning that conversation by putting out those guidelines. And so the ChatGPT is generally advisable to wait at least 12 weeks postpartum. And on all the Facebook groups, 99.44% of the time, if you get another fellow mother answering that question, that's what they'll say. And I have to say that on one hand, that's like incredibly encouraging because for a long time we didn't have an answer. We had moms that were not sure what to do, or even physicians telling moms that it wasn't okay to run in pregnancy or okay to run in postpartum. We are starting to have some data now. I think this was in one of Izzy Moore's papers from a couple years ago, looking at women that run in pregnancy and they have more mileage in pregnancy are more likely to pursue earlier miles in postpartum. Um, I think there's a lot of, a lot of pieces of the conversation to talk about there because if you have the capacity to run a lot of miles in pregnancy, chances are you're feeling pretty good. Those of us that weren't able to do that, we have our very good reasons why, like your bladder's really uncomfortable, your pelvis is really uncomfortable, those sorts of things. So you're going to be a little bit more sedentary. You're going to have a little bit more deconditioning. So it's going to take a little bit longer to build that back in postpartum as opposed to somebody who can potentially maintain it all the way through. And then, in postpartum, ideally they're able to kind of pick up where they left off without any significant issues. So we do have some data that's kind of, we'll have some of those examples where women can get back a little bit earlier. But that's again, that's the nuances. But I do appreciate that the general conversation is around that 12-week mark. And why we say that 12-week mark is, we generally have full soft tissue healing at that point. Generally by 12 weeks, we've got a pretty established pattern as far as sleeping, eating, and this is mom and baby. Ideally, other issues have been screened out. And again, this is probably assuming too that there's no immediate issues with leakage, no immediate issues with prolapse, no immediate issues with pelvic pain. So, the 12-week mark, like I don't think that's far off. And hopefully we're going to get some better data in the future that can really kind of clarify those people that, yeah, 12 weeks are totally good to go, as opposed to other people, they might want to wait a little bit longer. That said, I do love the caveat here. However, individual recovery times can vary, so it's essential to consult your healthcare provider to determine when you're personally ready to begin running. You're going to see that on most every paper that you read right now with postpartum return to run is an individual approach is best, which it's probably true, but also makes it really hard if you can't get that individual approach. And let's say you live in the middle of nowhere and the closest pelvic floor PT is 5 hours away to get evaluated or something along those lines. And so I think, again, we can have best recommendations and then recommendations that work for you is like, okay, if I don't have somebody, how can I piece this together? And that's where, again, I do think that there's a role for these groups. It's nice when somebody like myself is in there and I can kind of point and people in the right direction of resources. I do appreciate online resources and people that work virtually and that kind of stuff as well. So, okay, so moving on to the next one. What are the signs that indicate I'm ready to resume running postpartum? And it's so funny because in these groups, sometimes you'll get, well, you'll just know. I'm like, no. I'm like, especially if it's your first pregnancy, you know what the hell you're doing. Like, you don't know what things are supposed to feel like. I definitely knew when I wasn't. Let's put it that way. It was definitely, I had a whole lot of things going on with my first, like just the swelling and just sleep and just lots of things. But yeah, so the recommendations here are interesting because they're kind of excerpts from a postpartum return to run readiness screen. But when I look at them, and I've spoken about a little bit more about kind of what I screen out for. When I look at them, it's a great place to start, but I can see how somebody would do this, think that they passed, they didn't pass, or, you know what? Okay, you passed, but you probably shouldn't be running. You should probably be doing more strength work or some other type of work. I can see where that would be really easy to happen. And again, that's the trick in having a screening tool if you're DIYing it versus somebody else doing it. And I do believe, again, the screening tool, it's only, again, the 2019 guidelines I was using a version of another just orthopedic return to run screen before that and kind of mashed it up with this. It's going to evolve. It's going to improve. It's going to get validated. We're going to be able to do better with it. So again, it's better than nothing. But I mean, so here's what ChatGPT says: walking briskly for 30 minutes. It's like, okay. And having been a person that I could not do that right off the bat, it seems to be a very clear thing for me. But there's some people that, yeah, they can walk 30 minutes that first week and it's no big deal. Does that mean they're ready to run? No. What else do we got? Balancing on one leg for 10 seconds. Um, eh, what I would look at with that is like, how ugly is it? Like, are you all over the place or do you just barely hanging on? Or do you look solid? Do you look stable? Does your, what's going on at the pelvis? So those are all the things kind of going on in my head, but I can see where people are like, yep, 10, 10, boom, check. Performing 10 single leg squats per side. You can do it, but what does it look like? What's that pelvis looking like? Where's that femur diving in? Do we look like we have some instability issues that might later on lead to hip pain or SI pain or things like that? Like, I think I could probably have done 10 single leg squats and, balance a couple weeks in. Was I ready to run? Oh, hells no. Jogging in place for a minute. I think that one, usually when I do that with patients, any sort of hopping, jumping, whatever, the first thing that hits people is the boobage. And lactating moms know what I mean. Like, you feel things shifting and moving that you're not used to feeling shifting and moving. And so that's where I'm always like, yep, we need to figure out the support situation. We also need to talk about, potentially pumping or nursing right before you go out, if that's possible, because it's completely different feeling. Jogging in place also too is kind of that first step towards impact. But again, if you're barely moving and doing basically like a half-ass jog in place versus like a high knees, big impact sort of thing, like those are two very different things. And you can have a very different response to both. The next one, 10 forward bounds. Again, that one we're starting to get a little bit into impact. Could you fake that one? That's probably the one. And then the 10 single leg hops that are probably the easiest to, or sorry, the least easy to like fake. And I don't mean fake in a bad way, but like with compensations, like all the other ones, I think you can kind of make it through and be like, whatever. But there's a lot of like, I would look at those and see some quality differences. And typically single leg hops, moms are like glued to the floor, like they barely clear the floor. And to me, that's where I always want to know what's going on with the ankle. Like we want to get like, I don't want moms to feel like they're running through molasses. I want them to feel like a gazelle. In those first bunch of runs, if you haven't done any of that impact work, you feel like you are running through molasses. And we've got data that says that. We've had I think Jenny Bagwell was on the podcast looking at pregnancy versus postpartum. We limit our trunk rotation. We limit, our projecting forward. We're very up and down, and that can translate over into postpartum running as well. And again, it's a lot of quality stuff that we're looking for as professionals that I think if you didn't know to look for it and you just kind of said, oh, yep, walking briskly, balance on leg for 10 seconds, 10 single leg squats, jogging in place, 10 forward bounds, 10 single leg hops, and you're like, yep, I'm good to go. And the summary on there was like, successfully completing these activities suggests a readiness to start a gradual return to a running program. And then it's like, all right, well, now what does that look like? The group with Rita Deering, Shefali Christopher, I think Grania and Emma were part of that. Also, Lori Forner, Amanda Olson, Sinead Dufour, like a lot of our favorites, and many have been on the podcast before, did a Delphi study, and I did participate in that Delphi study where they're asking experts generally, what are you doing? They did talk about kind of that return to run readiness screen, what that looks like, and then also what does that look like as far as walk running. Do you do a couch to 5K, all that kind of stuff? Should you refer to a pelvic floor PT? Like what are the general consensus of things that should be doing? And again, I'm really excited because the very, very first thing on this list is consult a pelvic health specialist. A pelvic health physical therapist can assess your individual condition, provide personalized guidance. Yes, that's best case scenario. If you can do that, wonderful. If you can't, that does not mean you are doomed. Somebody brought that up to me many years ago, and it really changed my mind on, this narrative that everyone must see a pelvic floor PT because, frankly, like at least here in the States, we just don't have the capacity for that. We don't have our geography is such, our screwed up insurance system is such that not everybody can do that. So I want to be very, very clear that if you do not like take the opportunity, if you have it, absolutely. That's why I put a ton of free information out. But if you don't, read what we have to say, kind of like talk to other people, look at online programs, that sort of stuff. And that's where I do think, it's great to crowdsource. And hopefully in that crowdsource, they'll point you towards vetted, evidence-informed information that will say, hey, considering, general advice, this is kind of what we want to do. The next recommendation, it says strengthen core and pelvic floor muscles. This is where ChatGPT is a little wrong. We don't always need to start with strength for the pelvic floor. If you've done any Googling as far as the pelvic floor goes, you can have a pelvic floor that is underactive. You can have a pelvic floor that is overactive. Both of these can occur in a postpartum situation. And what that might mean is a lower tone pelvic floor that needs strengthening. Yes, we do strengthening with. If we have a higher tone pelvic floor, it needs to relax first, work on coordination, and then build back strength from there. So that's where, again, you see all these Kegel programs. There's also this weird like anti-Kegel movement that's going on right now, which is super weird. Like Kegels aren't the devil. Like they're not. I mean, but it's kind of like every pendulum. You're like, oh, do Kegels. Oh, wait, no, they're bad. Just do body weight exercises. Like, okay, can we just settle somewhere in the middle? Like we've got a ton of peer-reviewed data over many, many, many years pointing to the benefits of pelvic floor muscle training. There's got to be something to that. If that's the only thing that you're doing, okay, can we do a little bit of everything? I like the mashup approach. And strengthen the core. Again, I think the messaging's changing there, whereas for a very long time, we're like, oh, don't do ab exercises in pregnancy. Don't do them in early postpartum. No crunches, no sit-ups. We've got data now that's pointing to doing straight rectus abdominal training in pregnancy and early postpartum does not increase intra-recti distance, meaning maybe us not allowing women to do that for a long time potentially artificially induced deconditioning and atrophy. And maybe we need to be better about encouraging abdominal strengthening, hip strengthening, all that kind of stuff in pregnancy and early postpartum. And maybe we don't have so much to have to like make up for. I know that's always been kind of a deficit of mine. And that very much was the narrative when I had my kids. So I'm all about like, hey, let's if we know it's not going to make things any worse, what can we do to potentially keep women a little bit stronger, especially since the abs are changing. I joke around that they change zip codes during pregnancy, which they often feel like they do. So yeah, I mean, I think, again, the messaging is shifting there. Obviously, having a individual exercise program is great, but there's a ton of postpartum programs out there. I will dare say that 99.44% of them are all the same. I'm not going to lie. But whether or not that particular general program is going to address your problem, I think that's where, again, and if you've listened to the podcast before, I have my rule of thirds. It's like a third of the people, doesn't matter what you do, they'll be fine. A third of the people will respond to general advice kind of in the way that you would hope. And then a third of the people will not give the appropriate response to general advice and do need something that's a little bit more individual. An example I have recently was just somebody had reached out and said, I did all these Kegel-based programs. I also, went to see a pelvic floor PT and they gave me basically the postpartum mat program. You all know what I'm talking about. Bridges, single leg bridge, double leg bridge, clamshells, maybe a plank, maybe a squat, maybe a lunge. Really, really super generic. Discharged them. At 12 weeks, they went on their way, was running fine, and then later had some SI issues because, lo and behold, it sounds like the person was hypermobile, had some underlying, probably hypermobility issues, didn't get up into upright for their strengthening program. And when they started to try and do interval training, which requires a lot of efficiency, that wasn't there because that wasn't what they trained for. So again, there's nuances to it, but there's a place for generalized stuff, and then being able to build upon that. Start with low impact activities. Begin with walking and gradually introduce running intervals as your body adapts. This is not, it's too general. It's too general because this implies that you didn't just carry and birth a baby and not, you're not getting sleep, all this other stuff. Um, I I will stick to my guns in that a return to run is not a couch to 5K. A return to run should look like a return to run after an injury, after a surgery, very intentional dosed rest, very intentional number of reps, very intentional dosed work. Usually I will start with walk jog intervals. We'll start with bookended by walking, 5 minutes on either end. What we'll start with is 1 minute jog, 4 minutes walk. And with that, we'll repeat that 4 times and we'll do that particular session a couple of times just to make sure that there's no symptoms, with at least a rest day in between. And then slowly build up. We might go 2, 3, 3, 2, 4, 1. So they're up to 25 minutes. And at that point, then I give people a choice. I was like, all right, well, do you want to go longer or do you want to go faster? And typically moms decide they want to go faster because they only have this set period, 30 minutes of time anyway to get out. And so if we're going to do that, we need to make sure that, and again, all of my patients, if we're going to do a walk run program, they have to be doing some sort of strengthening at least a couple of times a week. I'm like, if you can't do that, then understand that this is not going to go well. And if we're going to do pace work, we definitely want to be doing impact drills as a part of that training. And we want to make sure that we've got good, efficient stability in that pelvis so that when you have to power through, the engine doesn't break down. Like the mechanics don't break down as far as the pelvis is concerned. So I don't think it's as simple as just walk and then slowly run faster. Like it unfortunately just doesn't work that way. I do find that moms, if they've had any prior sports injuries, if we use that analogy, it makes a little bit more sense, which I truly appreciate. Listen to your body. I hate this one. I'm not going to lie. I think half the battle is not only interpreting what your body is saying, but also understanding it's speaking a different language than it did. And you're having to kind of interpret that and learn that because you're tired, more tired than you've ever been in your entire life. Anybody that you think, oh, I stayed up and partied all night, or I could stay up late and study when I was in college. This is not the same kind of tired. This is, and I did not do this well initially. It's like you've been able to do everything that you want on your time your whole life. And then, it's 2 a.m. and somebody's screaming and you can't just ignore it. And if you fall asleep and if they fall asleep nursing and you haven't burped them, guess what? You're going to get woken up by a scream 45 minutes later because guess what? They've got to burp. So all of that included, you're still trying to figure out which end is up. And depending on how much of stuff is going on with your baby, with your pelvic floor, with, the resources and stuff that you have, with the help that you have, like paying attention to signs of discomfort or pain, your brain may not be processing that great. Throwing in depression, all that kind of stuff, increased anxiety, just know that you are calibrating. You might have been in touch before and you might not feel in touch kind of in those initial weeks. And so that one and again, it's also, yeah, it's not the same. It's not the same. When you feel stuff and then you freak out because you've never felt that thing before, that also kind of puts the alarms up and whatnot. Yeah. And so the last thing they heard, they're like, oh, follow a structured plan. Utilize a postpartum running plan that outlines a gradual progression to help you safely increase your running activity. Okay. What the frick does that mean? Years ago, so 2020, there was nothing out there. And I had a patient facing, return to run course that I've since pulled down because there's so many free guides that are out there now. And do these exercises this week and run this much. And it's so prescriptive. And I think that it makes it really hard to be that way because there's so many other variables depending on whether your kid slept the night before, how's your nutrition, is baby pooping, is baby napping, what are your work demands, what are your household demands? It's really, really hard to be prescriptive. And when you don't have a lot of brain cells working in your favor, thank you, hormones and estrogen crashing, it makes it really hard to make those decisions. And so sometimes, again, I agree. I would love a structured plan. Sometimes that works and sometimes it doesn't. And what I would say is if you follow a structured plan that you got online for free, assume that you don't necessarily have to follow it verbatim. And that's where, again, I think you kind of get what you pay for. Is you're going to get more individual recommendations the more resources you kind of put towards that. But if that's your choice, like, okay, this is the situation I'm in, I've got to use the free guide, you can fudge a few things. And I mean this in a way where it's like, if it tells you to do something every day and you're like, I can't get to that, then don't. But get to it in the amount of time that works for you. Like, if you're going to start a walk run program, please make sure you're doing some sort of strengthening a couple days a week. Like, that kind of general advice I can get behind. If you are returning to run and the only exercises you have are on a mat, no, we need to get up off the floor and be doing some upright strengthening. You need to be doing some impact. We need it to be doing some balance exercises. All of those things. And if you don't have time for that, that's okay. It doesn't mean that like running's off the table for you. You will get to it on whatever kind of schedule that it's going to be. It is not off the table. So anyway, that's kind of running through. Remember, everyone's individual postpartum recovery is unique. I'm sure moms are like so tired of hearing that. They're like, yes, I know. Prioritizing your health and well-being is essential for a successful return to running. And I say that out loud, tongue-in-cheek voice, because I think we all hear the words, take care of yourself. But when we don't get that back from society, it's like, okay, well, where's my paid leave? Where's my childcare that isn't a bajillion dollars? Where's my not guilting me because I went out for a walk by myself? Like in the guilt for, oh, well, you're pumping, or I'm sorry, you're doing formula instead of, breastfeeding. Like, if we could just ditch all that stuff, I think it would be a lot easier to wrap your head around truly believing that society wants you to prioritize your health and well-being. So I always kind of chuckle tongue in cheek with that one, because we all say it, but I don't know that society is really on board with that one. But again, it depends on your community. So if you have a community that gets what you're trying to do, that's why I love the moms that they will not ask you. They will just show up at your door and leave a casserole dish on your front porch. And guess what? It'll be recyclable. They don't want that dish back because they know you don't have time to clean it. I think it's that kind of community that gets that we are all trying to figure it out. Nobody has written the book on your kid and your experience, and that's what you're trying to figure out, while kind of understanding this general advice and so on. And yes, the evidence states that your best case is to get individualized care. That's not always possible. And I'll have another episode later where we kind of talk about, okay, I'm doing the right thing. I went and got individualized care. They told me I graduated, but I'm still not better than what, because that's a whole nother ball of wax. But that all goes to say that big picture is we have come a long way. Yes, we have a lot of generalized information out there that if you are not having pelvic floor issues, if you are not having back pain, pubic bone pain, hip issues, those sorts of things, that the general consensus is somewhere between 6 to 12 weeks, you should do a run readiness screen to get a sense of your strength, tolerance to impact, and balance. Somewhere in there, you should make sure that you're eating enough and getting enough sleep, and try a slow progression of walk, run, to slowly start to incorporate running back into your exercise routine. And that if you experience any issues, you should seek the advice of a pelvic floor physical therapist. So the general consensus, that's all good. And again, like, that wasn't even 5 years ago really common knowledge. I feel like it much more is now than it ever was before. So I do appreciate all those Facebook groups that are out there. I do appreciate the crowdsourcing of information and saying, hey, this was my experience, this kind of stuff. But what I will say is, if you're really trying to figure out an issue, your local Facebook group is just understanding it's somebody else's experience and their interpretation of that experience. It's not medical advice. Also understanding too that podcasts, we have to say for entertainment purposes only, and seek the advice of your own physician, all that kind of stuff. And same thing with it, our social media. DIY, can you get there? Yeah. You'll get there faster if you work with somebody that is trained and experienced and kind of finding patterns and progressing and that kind of stuff too. But yeah, we're far better than where we are before. Cheers to ChatGPT for something, for I think asking a lot of the general questions that I do see where moms are they really want to know how to do this kind of the right way. And cheers to those groups that are trying to crowdsource information and get people pointed in the right direction. And thank you for all of you that are continuing to share the gospel of pelvic floor physical therapy. The most recent one, Allie on the Run, Allie Feller, she did an Ask Allie episode recently. And, somebody had asked, there's a lot of questions in that Facebook, by the way, about pregnancy and postpartum running. But yeah, on the Ask Allie, they'd asked her postpartum running. And she's like, pelvic floor PT and, find somebody to work with. And again, it's when voices like that, yeah, they could share their own experience, which she did. But she's like, hey, this was my experience. Go see somebody that this is their actual job that they're trained in. I can't thank you enough for sharing that, because the more people that kind of know about us and kind of know how to find us and can access us, and even if you can't come find us, and we have a lot of free information and resources to kind of help you figure out what to do. And if you've ever DM'd me before a question, I'm going to respond back. So I'm sure I just invited a whole bunch of DMs just now. If you ever have a question, like I love finding out where people from. If you don't have a resource locally that you know of, I am pretty well connected in the pelvic health world. I'm happy to help you find a resource or help you. Lots of times I have people, I'll send them certain PT locators and I'm like, hey, come up with a list here. The websites that I give them are it's aptapelvichealth.org, pelvicrehab.com and pelvicguru.com. I said, go to those, pull the list of people that are in your area, look through them, figure out what matches your resources, and then send me the list. And I'm happy to look at them and vet the resources for you and see what might be a good fit. Because I used to do it the other way. I used to give people names. They're like, I can't do that. I'm like, it's just faster this way. So yeah, I'm always happy to help you find resources. And then I also, and again, we'll get into this in another episode, but I love doing second and third opinions. So, if you've seen, you've tried to do all the right things, you've gone to see 2, 3, 4 different pelvic floor physical therapists, and you have this one particular thing that just isn't changing. That's where I really love to sink my teeth in and problem solve. And it can be really fun and collaborative. And most of the time we can find an answer and move forward. And that's super, super fun. And we do that virtually, which is fantastic. So it doesn't matter kind of where you are in the world to be able to do that consult and help people problem solve and get resources to help support them and get them back running as symptom-free as possible. So anyway, I hope you enjoyed this little solo rant and this little journey with ChatGPT. If you have questions specific, like I said, you can DM me at Carrie Pagliano on Instagram. If Instagram is dead for whatever reason, who knows these days? You can always feel free to email me, Carrie@carriepagliano.com. I promise I read everything and I respond to everything as long as you're sweet and kind. And happy to help. So thanks for listening, and tune in for another great episode of Active Mom Podcast. And again, if you enjoyed this episode and have more ideas for things to chat about during solo episodes, be sure to message me. And also don't forget to give us 5 stars on your next podcast review. I was going to say thanks for having me. Well, yeah, thanks for having me. Have a good one. If you're navigating pregnancy, postpartum, or perimenopause, whether personally or professionally, check out all our free resources and upcoming courses at carriepagliano.com. This podcast reflects the opinions of Dr. Carrie Pagliano and her guests, and it is for entertainment purposes only and should not be considered medical advice. Always consult your healthcare provider with any medical questions. If you enjoyed the episode, please take a moment to leave us a 5-star review on your favorite podcast platform. And thanks for listening.